Welcome back to the IndeVets Happy Hour. I'm your host, Dr. Andrew Heller, DVM. I'm with my co-host, as usual, Dr. Marisa Brunetti.
VMD.
VMD, I'm pointing to you. All right, so thank you for joining us. If you caught our last episode, it was about what's new in 22. It was really interesting. We had a whole bunch. We had a nice panel on here.
We did. We did have a nice panel.
That was a lot of fun, and we should do that again soon. Today, we're going to get back to some basic medicine, if you can call it that.
Continuing with endocrinology, because apparently we really like endocrinology.
Yeah, we're going to talk about canine pancreatitis. We're separating that, obviously, from feline pancreatitis, usually different presentations. So next time, we should talk about feline pancreatitis. So stay tuned for that. The goal of the episode is really to talk through what we're going to see as general practitioners, and talk about what you might see in the ER or an urgent care setting. This episode is intended mainly for general practitioner veterinarians, but obviously practice managers joining us, technicians, assistants who are just interested in this stuff. Definitely listen up. A lot of good information here.
I also think that sometimes when we say pancreatitis to pet owners, they're like, what? Like googly eyes, because like it's a big word and we don't talk about it a lot in human medicine. I mean, it does happen in humans, but it's not a common word, obviously. And so I think for pet owners, like hearing this word and then, understanding that it can look like a lot of like things, that they may think their dog had, like, oh, they just ate something, like foreign. This is actually, it's good to hear that this is something that can happen fairly commonly in a dog. And so I do think pet owners will like this episode.
I kind of like this topic because in general practice, we don't always think of like pancreatitis when we see GI upset. Like we always usually think dietary indiscretion and we think foreign body obstruction and toxicities and things like that. And pancreatitis is usually like, we don't really think of it as being a mild issue. Usually, we usually think of pancreatitis as this severe disease, which it can be. And we'll talk about that today.
Yeah. So let's jump in.
Yeah.
So, I was going to tell a little story. When I was in the clinic 2 weeks ago, I got this sick appointment on my schedule and it was like, dog's been vomiting, since 4 a.m. and doesn't want to eat. And I went into the record and I was like, oh, it's a 12-year-old miniature schnauzer. Oh, it totally has pancreatitis, right? So talk about, what breeds, commonly get pancreatitis.
Well, yeah, I mean, I think you hit the number one, the numero uno, miniature schnauzers, but Yorkies tend to come up a lot as well, and other terriers as well. Typically smaller dogs, but it can be any breed, mini poodles as well. Mm-hmm. Typically older dogs. You're not seeing this generally in the puppies. You're seeing this in, middle-aged to older, often overweight dogs. And, even in dogs that, have diabetes, Cushing's, or hypothyroidism are at a higher risk.
Endocrinology.
Yeah, hence endocrinology. Good.
And why is this disease actually important to like keep on your differential list?
I mean, it can be deadly for sure. I mean, it can be deadly if not treated. This can certainly cause, an acute severe reaction in the body. We'll talk a little bit about like DIC and SIRS, and these things are really deadly. And if they're not hospitalized in some of these, more moderate to severe conditions, then really the prognosis ends up being poor, which we'll talk about as well. So as general practitioners, we often see this in mild cases. We might not even really realize we're dealing with the mild cases sometimes. We just kind of treat the symptoms and have them go. But if it gets severe, it's certainly poor prognostic indicator.
Really briefly, what does this look like in your patient when they come in?
Like I said, it's going to be very similar to any acute abdomen presentation. So abdominal pain, you may or may not notice that on exam, but oftentimes they'll come in having been vomiting, not eating. If you do a temp, which you should, they would often have, fever, elevated temperature, and oftentimes they'll have diarrhea or even like bloody diarrhea.
Yeah.
In some severe cases, they can already have some jaundice, some icterus. Mm-hmm. That you may note on exam as well.
And I would say if we don't notice the pain, because animals are really good at getting adrenaline rushes, when they come to us, pet owners, you may notice something really subtle, like they don't want to go for their long walk, or they're just sitting in the same spot in a room, or, sometimes they can like be hunched over. And if you like touch their back, you may think they have back pain, but they can have abdominal pain. So something to look for in, just for pet owners.
Yeah, and obviously the more severe cases that you see, they could be in shock. They could be recumbent.
Yep. They can have, free abdominal fluid.
The one thing that I found in some research was that they're almost always dehydrated from all the vomiting they've done. But sometimes you can't tell because they could be so nauseous that they could be hypersalivating. And so you may not notice that. And then because a lot of these pets are fat, you might not notice the skin tenting either. They just got a lot of that subcutaneous fat that you just can't see that. So, the dehydration is usually more severe than they look like. Right. So just assume they're dehydrated. And we'll talk about that when we get into treatments.
That's a really good point. I didn't even think about that. But all right.
Well, let me ask you some questions. I feel like I'm answering everything, and you're usually the one that's here as the expert. Don't worry, I'll give you the easy ones.
Thanks.
What is the cause of pancreatitis?
Who knows? No. So usually it's diet, in dogs. So when the digestive enzymes, they get activated prematurely within the pancreas because, for lay people out there, the pancreas is responsible for, lots of digestive enzymes. And usually it's like mostly from ingestion of fat, really high fat diet, going through the trash and like eating, horrible, terrible things, may happen after Thanksgiving, or, we talked about, diabetes. If they have hypertriglyceridemia, you can also get pancreatitis from that. Obviously, there's other things that are less likely, but you can see it from trauma. You can see it from certain drugs like azathioprine, tetracycline, potassium bromide. I always forget about that one. And, there are other potential causes. I know generally, I was just reading in today's veterinary practice, steroids are not shown to be a cause of pancreatitis, but you can also see it post-GDV, which is interesting. I've never seen that. Have you?
If you are doing an abdominal explore and the pancreas gets manipulated, twisted, if you're a little rough in there or if things are happening in there, I think they can just cause almost like just trauma to the pancreas, which can cause inflammation, causing pancreatitis. So I think
that's true.
I think that's where they were going with that.
Yeah, and you're right about the trauma. Like if you're just doing regular surgery in the abdomen and you rough up the pancreas for some reason, like I always remember, like I would see it when I was doing surgery. I'd be like, don't touch it.
Don't touch it.
Don't touch it.
And when we get into how to diagnose it, sometimes you have to touch it to really get a 100% diagnosis. Sure. But we could talk about how most people diagnose it, which is not surgically.
I was going to say, I'm like, I hate the diagnosis of pancreatitis, but, walk us through some things that you can see in typical blood work, and then what are some additional diagnostics if you really want to find that this is pancreatitis?
Yeah, I think the most important thing to note about, certain diagnostics is that because it can be so variable in its presentation from, very mild to very severe, there's no like pathognomonic, there's no specific way to diagnose it on any test. A lot of these tests can be normal, even if they do have pancreatitis. So like on a CBC, you may have an inflammatory leukogram, but you don't always. You may have thrombocytopenia. You may have a low hematocrit or a high hematocrit, just depending on where you are. So that's not really that specific. A lot of people used to look at the lipase and amylase on the chem profile. And if you see severe, like if you see it really high, and you have the symptoms at the same time, very high likelihood. But again, 50% of the time it could be right, 50% of the time it can be wrong. There are lots of things that can cause that increase in lipase and amylase. Pretty poor sensitivity on that test and specificity. There are some other tests that we've now come to rely on. So there is this test called the CPLI, a PLI SNAP test, and it just stands for Canine Pancreatic Lipase. It's a great test. It's fairly sensitive 80 to 85% of the time. It's not perfect, but again, we're not just looking at one test to diagnose this. We're using a lot of different things, which we haven't even gone down the list yet. But what's nice about the SNAP test, it takes 30 minutes, and most of the time you either get like a abnormal or a normal, meaning there's some kind of threshold, and if it's above that, it says it's abnormal, and you can pretty much tell that it's pancreatitis from that test.
Yes. And that one is not quantitative, right? Like you said, it's either normal or abnormal. If you want the quantitative version, then you need the spec CPL, and that is not in-house. You have to send that to a reference lab, and it is a little bit more expensive than the SNAP, obviously.
So would you say the SNAP has become pretty much the standard at this point?
I mean, here's the tough part. So like some Antec profiles have a spec CPL in all of their like wellness panels. So it'll just show up on a chem. So I do see a lot of specs happening, and working in a lot of our partner hospitals, not all of them even have the SNAP CPL because they're just like sending out the spec. So, or they're just treating, supportively anyway until that test comes back. So I've seen both, but I would say it's probably the most common additional test, the CPL, whether it's spec or SNAP. Spec or SNAP. Two cool names for dogs.
Spec and SNAP.
Yeah.
I like that.
Amylase and lipase, also good names for dogs.
So with any acute abdomen, we're also going to want to use some diagnostic imaging. And in a general practice situation, we have radiographs at our disposal. So we're going to take some abdominal radiographs. Typically, we're not going to see anything. In the literature, they do talk about some mild changes that you can see in the duodenal region.
But I'm not going to pick that up.
Yeah, I don't think anybody's going to pick that up. Basically, we're trying to rule out other things with the radiographs. Right. Really, the imaging that is more effective is the ultrasound. And up to 70% of the time, radiologists can pick this up, or a good ultrasonographer can pick this up. And, what they'll see is a hypoechoic pancreas surrounded by hyperechoic fat in the region of the pancreas.
I'm not going to find that, but
yeah, you're not going to find that. But if anybody is great with ultrasound, that's what you're looking for. You're going to see a thickened pancreas. Oftentimes, you can see the biliary duct. And really what you're looking for, you want to, again, one of the things to rule out would be like a mucocele, gallbladder mucocele. Yeah. So usually even to the less trained ultrasonographers, they can rule that out as well. One thing that I did note was that if you are doing an ultrasound and the animal's hospitalized, you may want to repeat the ultrasound. If you don't find it, you may want to repeat the ultrasound later on in the day because things can change pretty quickly with this disease.
That's a good point.
Of course, if you have that, although we all know our radiologists are super busy right now and
so busy. Yes.
Unlikely they'll have that in their day. We're going to take a quick break, but we'll be back in a minute to discuss treatment for pancreatitis.
I'm a veterinarian, sure, but I'm way more than that. I'm also a tango dancer, a struggling but determined pie maker, and a mom. With IndeVets, I get to choose when and where I work. I create my own schedule and choose shifts at nearby animal hospitals that are right for me. Having that flexibility is exactly what I need to have plenty of time for all those other things that I am. Because I'm more than just a vet. Visit IndeVets.com to learn more and apply.
All right, well, let's talk about, I guess this used to be more of a controversial topic, but treatments. Treatments for pancreatitis.
Like I said before, dehydration is going to be one of your biggest issues to combat. That's really the most dangerous aspect of this, is keeping your pet hydrated, the patient hydrated. Mm-hmm. So fluid therapy, IV, preferably. If it's mild, you can get away with some sub-Qs if they're going home, but that's just not going to be effective enough if it's even moderate to severe pancreatitis. You may also want to be monitoring the albumin on the chem. And if it's below 2, you'd likely want to start the dog go from crystalloids to some colloids, like hetastarch. There can be some third spacing with this particular disease, and you want to keep the vasculature hydrated with colloids.
Yeah, I was reading in today's vet practice about plasma, like using plasma, and, there's little information regarding this use. The
best use for plasma is if they are thrombocytopenic,
sure,
and they're going into DIC. Yeah. That's when you really need to get that fresh frozen plasma out. But if we're just talking about more moderate case, then certainly colloids, crystalloids, likely colloids. You talked about some controversy with this. So when it comes to feeding, I remember when I did an internship, most of the doctors I worked with, they put the pet on NPO. Nothing per os, nothing by mouth for 48 hours minimum.
Mm-hmm. Yeah, rest the gut. Yeah.
But now a lot of practitioners out there are choosing to feed through it.
Yep.
If possible. Obviously, we have to make sure the animal's keeping things down and not vomiting. So we're still using antiemetics, and meropitant is the antiemetic of choice with this. There are places that are still using ondansetron, dilasetron, but the studies that I found said that meropitant was better.
Or you could use both.
That's true. It's easier. It's once a day anyway.
Yeah, true. And obviously, like you said, if we're not resting the gut, you still want to make sure that you're feeding a low-fat diet.
Absolutely. In severe cases, which I know this is for general practitioners, so you're probably not going to do this, but even giving them a feeding tube and bypassing the stomach and the duodenum, getting it right into that, jejunal space, NJ tube would be ideal if you're trying to feed them through it and get them some nutrition.
Yep. So we got fluid therapy. We've got low-fat diet, preferably, and not holding off food. I mean, if the animal's not eating that, that could be tough. Antiemetics. And then probably something I think is the most important, analgesics. This is a painful disease. It's like when I have a stomach bug and I go to my doctor, I'm like, I need you to give me pain meds. I can't even imagine what pancreatitis feels like. Like, we tend to forget that GI disease can be pretty painful in pets and ourselves. So absolutely recommend opioids.
Yeah, definitely opioids. Stay away from the NSAIDs. We're at this disease, we're at risk of renal issues. We're at risk of gastric issues. We don't want to be giving them any NSAIDs. So I would say pretty strong analgesics, strong opioids. So I'd say the weakest one out there, maybe buprenorphine. Yep. So skip the butorphanol completely. If you only have that
for most things.
Yeah, for most things, exactly.
For painful things.
A fentanyl patch is great if you have them, especially for the more moderate to severe cases. What do you think of that?
I haven't seen fentanyl patches since I've seen them phased out. But yeah, IV fentanyl, of course, or, some sort of MLK drip or something like that.
So how do you feel about antibiotics? I always want to ask.
At Penn, we were taught.
Here we go.
Not to use antibiotics in pancreatitis. Now, obviously,
case by case.
Case by case. I have never used it in a mild case or had the need to, I suppose. But of course, if this animal is, septic and has fluid and GI breakdown, like, they're going to be on IV broad spectrum antibiotics, right? But I've never had to do that.
What about metronidazole?
You mean for its anti-inflammatory properties? I've never.
That and if they're having bloody diarrhea, it might be worth it.
Yeah.
If you can give it PO.
I have not done that, but I guess, I don't, that wouldn't hurt.
Yeah, it wouldn't hurt. I'd probably do it. Now, what about steroids? Corticosteroids. This is also a little bit controversial.
This is controversial. I've also never had to use it.
Yeah. I feel like when you start getting desperate in these cases, you start reaching for it, right?
I mean, at Penn, we always said better pred than dead. So yes, but no, typically it's avoided in acute mild pancreatitis. Even though we no longer think steroids cause pancreatitis, it's still pretty much avoided. But of course, you could throw it. You could throw it at the dog in low dose.
So Marisa, I know you think everything has Addison's disease. Would you be a little worried about Addison's disease with a case like this?
Yes.
Yeah, of course.
But especially if it's a poodle.
So maybe one dose of steroids isn't so bad.
You can tell we're crossing the hump of 10 plus years being veterinarians.
Well, the good thing is there is an experimental drug out there that when I was doing a little bit of research for this podcast, I came across. So I don't know too much about it, but I'll just say it.
And we also don't know how to say it because we've never heard anyone say it.
It does end in IB, so it's probably one of these new, Janus kinase type things. Fuzapladib.
Yeah, sure.
It is a LFA1 inhibitor, and it blocks neutrophil extravasation. They've been doing some studies in Japan on this, and it was pretty crazy. It actually said that went from a 50% mortality rate in their patients to 0%. So,
and this is severe pancreatitis with
severe,
SIRS.
Exactly, yeah. And the one thing is, all of the pancreatitis cases were induced pancreatitis. They weren't naturally occurring, so.
They were probably worse then. No, I'm just kidding.
They're probably worse, yeah.
They were probably worse. All right. Well, that's good news, except that it's not yet licensed in the U.S. or Europe, but always good. Yeah, keep your eye out and try to pronounce that name.
I'm sure they'll come up with a name, that sounds pretty, like Serenia and Convinia and Silencia.
Sure. And obviously, Andrew, we want to send these dogs home on a low-fat diet. Hills and Rural Canine and Purina, they all have a low-fat diet that is, easy on the GI tract. So we want to put them on that. And if your dog has recurring pancreatitis, they may be on that long-term or forever. So that's definitely something to keep in mind as well. I like to, when I'm practicing, I like when they keep cans of some low-fat diet lying around because I'm inherently going to use that, for these mild cases for...
Like ID?
Yeah, ID low-fat is usually the one that I see the most.
Yeah.
Most of us know the prognosis for mild cases is good. We've seen it a lot, but... You talked a little bit briefly about like severe cases and SIRS, and if it's pretty guarded, if it's severe, they're going to need 24-hour care, obviously, and product and lots of IV fluids and meds. So.
Yeah, and the one thing is, if there are any, pet parents out there listening to this, if your pet gets pancreatitis and it gets bad, they're probably going to be in the hospital for a week. So
yes,
everybody listening, just know what that means. It probably is going to mean a $10,000 bill.
And what does that mean pet owners should get? Prior?
Pet insurance.
Yes, pet insurance. When they're puppies.
At least by the time they're middle-aged and fat.
Oh, yes. It is not a cheap disease to treat, even with mild cases. I mean, with your diagnostics, of course, like this can be pretty pricey.
You could probably, just in the diagnostics, you could hit $1,000.
Yeah. So pet insurance, but also keep your dog out of the trash. And
if you have a miniature schnauzer, get your yearly blood work, monitor your triglycerides.
Yeah, true. All right. Well, we hope you enjoyed this episode on the IndeVets Happy Hour. Thank you for listening. Tell your friends. And if you like us, leave us a 5-star review and make sure to subscribe so you can be alerted whenever we have a new episode. If you have questions, comments, or suggestions for future episodes, you can email us at clinical@indevets.com. Also, to learn more about us and how we're making vet med better, head to IndeVets.com. That's IndeVets.com. While you're there, be sure to head to our blog for the latest stories and tips from our doctors. And lastly, if you're interested in joining our amazing IndeVets team, please email Dr. Andrew Heller at andrew@indevets.com. See you next time. Cheers.